Hello, everyone, and thank you so much for joining us for today's presentation, Telling Your Workforce Story, Branding and Marketing for Effective Recruitment to Strengthen Health Center Staffing. My name is Rick Brown, and I'm with the Association of Clinicians for the Underserved. I'll be your host for today's webinar. Before we begin, I just wanted to go over a few quick housekeeping items. First, if you encounter any technical issues today, please reach out to my colleague Jen, who is also on the line for assistance. Second, today's presentation will be recorded, and we encourage you to ask any questions that come to mind during our concluding Q&A. You can also ask via the chat or enter your question into the Q&A panel. At the end of the session, also, please complete our evaluation. It's very helpful to help us improve the quality of our training. Lastly, I'm pleased to introduce today's moderator. Amanda Pears Kelly is the Executive Director of the Association of Clinicians for the Underserved, and we're thrilled to have her with us to introduce today's speakers and moderate our Q&A. I'll turn it over to her to get started.
Thanks, Rick. Welcome, everybody. I think I will start by saying, what a week. Lots of intensity, lots going on. I hope everybody is finding time to catch their breath, regardless of where you happen to fall in the outcome of the election. But one thing that I will say is I'm really excited to get to work. And there are so many opportunities for health centers in the months and the years ahead with this new administration. And the conversation today really ties to a lot of that work. And so I am hopeful, I'm optimistic, and I feel very charged up to get to work. So I figured we would start with that, or I would start with that, but I'm also really excited to be joined by a wonderful panel of speakers and colleagues. Suzanne Spear on the ACU team, she's our VP of Workforce Development. Total rock star guru in the space of workforce. I think probably you guys know her already. But by way of introduction, she has been doing this a long time for ACU and prior to that at the Virginia Primary Care Association. Just a wonderfully rich history with health centers and such an incredible voice for the needs that health centers have in the workforce space. So I'm excited to first turn the mic over to her to get us started with the next part of the presentation and then introduce a couple of additional colleagues and panelists later on. But to Rick's point, if you have questions or comments, we do want this to be a dialogue and to be conversational. So please make sure to engage in the chat. And we'll have some time at the end for that conversation too. So Suzanne, I'll turn it over to you.
Wonderful. Thank you so much, Amanda, for that introduction. And absolutely just so thankful to be here today, to be with you all during this week where, as Amanda said, our work is more important than ever. And so just, I think, Amanda, you put it really well when you said you were really charged up because nothing really, it just sets the fire in me and to keep doing what we're doing and frankly, do even more. So as we start today, let's set the stage a little bit for the current stage of the patients that we serve and also the healthcare workforce that serve those patients. Next slide. So many of you are familiar with the statistics in terms of the amount of people that health centers serve. When I first started working with health center 15 years ago, I was no idea the depth and the breadth of the health center program and the amount of lives that were affected positively by the health center program. And so the latest data from HRSA that came out recently in 2023, so last year, more than 31 million people are served and receive their health care at health centers. That is a staggering number of people, and including 1 in 8 children. That is a ton of kids that go there and that rely on their health centers for their health care and their well-being. Not only that, but there were also almost 200,000 deliveries and more than about 600,000 pregnant people were served by health centers. And so not only are they serving, current, lives and bodies here, but really the future of the United States. And so the impact that health centers have, as you know, is so great. And so when we think about all of the different types of people that health centers serve, there have to be people that take care of them. And that number is also staggering. Next slide. And so when we think about the need for health center staff and those working in health centers, providers of all different types, support staff of all different types, and then the folks that, that help keep the lights on. There are, a ton of people there that make things happen and really help the team. But at the forefront, we really think when we think about workforce, people, and we really tend to think about provider staff. And, as those numbers are increasing of the folks that the patients that are served by health centers, really the disparity between the number of folks that health centers are serving and the number of clinicians and providers that are available to serve those populations is really it's really going further and further apart. And the Bureau of the National Center for Health Workforce Analysis has a wonderful website. If you're really interested in diving into these numbers even more, the link is there in the slides, and you will receive those, I believe, after this. But really, it showcases all the different types of providers and really the need for those providers. And this graphic, you can kind of slice and dice the data any way you want it, but I just put this in the next 6 years. So in the next 6 years, the demand for the demand for services and the demand for the provider staff and the provider workforce is going up, and the supply is going down. So we have to really figure out a way to bring those two closer together, and we can do that in a variety of different ways. There is no magic wand. There isn't anything that we can, tell you, as you all know, that is just going to change this problem. But there are things that we can do to really help the recruitment and retention of our healthcare workforce.
Wonderful. Thank you, Suzanne.
Absolutely.
We're really excited here also to look at some of the insights that we're seeing from the field, as well as some of the potential solutions that we're seeing in terms of workforce challenges at health centers. And here I was particularly interested in what you and Amanda are really hearing with your finger on the pulse of the field, so to speak. So with the first question, I just really wanted to ask both of you, what workforce challenges are you seeing that really seem to be sustained in today's landscape for health centers?
Maybe I'll start, Suzanne, and then kick it over to you. Okay.
Sounds great.
Well, the first thing I'll say is that sadly, but not surprisingly, every time I talk to a health center workforce, if it's not the number one issue, it's usually number two. And I think for a long period of time, those challenges were limited to clinicians, but now it is every corner of our healthcare workforce. And so, certainly, I think persistent issues around wages, whether that's call center staff and, or front of the house staff, so to speak, but it's also providers, particularly I think I hear it in urban areas where there's just a lot of competition. And so trying to keep up with that and get creative around how to incentivize being at the health center beyond just mission. So that's something that I hear quite a bit. And then I think the other challenge, particularly in the clinical space, is that there's just not enough providers. So the competition to get them into the health center, that's something that we've been dealing with for years, right? That's not a new challenge. However, I think through the pandemic, obviously we saw a lot of retirements, early retirements. Obviously, we saw a lot of people transition from sort of a stable place of employment to whether it was traveling or other employers. And so the healthcare workforce shrank. And even more than it was already struggling before. And so I think those are some of the persistent challenges that I see. Suzanne, I'm sure you have more. It's a little doom and gloom to talk about this part of it, but
Yeah.
reality.
Absolutely, Amanda. And really just echoing your comments, some of the things that, we continue to see as you mentioned is retention, retaining staff. COVID really exacerbated this, but retention's always been a problem. And to your point, Amanda, wages are a huge part of this. People need to feed their families. Inflation is really incredible. And, going to the grocery store is painful. And so really losing staff at all levels, to your point, also has really continued to be an issue, and I think it's only gonna get worse there. And then, again, also competition from so many different types of employers, not just not just other healthcare entities, especially for our non-provider types. Of support staff and things like that, and so competition is just fierce, and again, maybe even more. So I would say those are, I would just echo your sentiments, in terms of just really things are tough out there. And again, not that there are things that we can't do to overcome it, but there really are a lot of challenges, when it comes to the healthcare workforce that have only been exacerbated, in the last 5 years. So those are some of the challenges, Rick.
That is tremendously helpful. I'm curious, it's really some of the trends that you had mentioned too really feed into our next question too, which is what emerging challenges, Amanda or Suzanne, are you really seeing coming out of the field?
Maybe we'll do the same thing. I do want to share, we're talking about challenges, but the whole point of this conversation is to talk about solutions. So it's not just
Absolutely.
about, the issues and the challenges that we face. I like talking about solutions, and I'm really excited for the next part of the conversation because I know we're going to lean into that. But in terms of emerging challenges and issues that I think are certainly maybe not brand new, but certainly more persistent. One thing is housing. What I'm hearing often from health centers is that they found a provider. They're poised to come, they're excited to join the team, and they don't have a place to live. And so it's causing health centers to sort of evaluate, what does that look like? Do they try to get into real estate? And then there's different levels of housing. I think that's not just at sort of the upper tier of providers and those who need, whatever their needs are, but for a family or whatever the case may be, it's really every level of the healthcare workforce, like we were talking about before, where um, affordable housing is just challenging, wherever you happen to land in that ladder. And so I think that layered into things has been interesting and challenging. Um, I think the other thing is, because funding for the National Health Service Corps is unfortunately going in the wrong direction. We're seeing fewer successful applications for loan repayment and scholarship. So there's a downward trend on that side, and that unfortunately is having a negative implication as well. We're fighting as hard as we can in Congress to see those dollars and resources increase. And part of what we're talking about is what this looks like on the ground and the reality. But I think that's certainly not new, but I think it's emerging in a new way because we are coming out of a historic investment in programs like the National Health Service Corps and the Nurse Corps program, but that funding is now declining. And so, unfortunately, the placements to support and the support for recruitment and retention is shrinking. And so I think that's another one that we're really facing right in this moment. Suzanne, how about you?
Yeah, absolutely, Amanda. I was on a call, the other day specifically around, workforce challenges in rural areas, and that was something that came up as housing is lack of affordable housing just everywhere. And there are some places where it's lack of adequate housing, things that are, we would consider, safe and, livable even, but definitely affordable housing, especially in those rural areas. And, also when it comes to loan repayment programs such as the National Health Service Corps, a lot of health centers rely heavily on this. And with changes in a variety of different things relating to the National Health Service Corps, they just aren't able to utilize that as a recruitment tool, and also a retention tool. So it really it hits them on both sides, right? And that's new, or has emerged since the pandemic, and since, to your point, Amanda, things have the funding is really going in the wrong direction. And so, I know that ACU is really working hard, to raise awareness of that and how it impacts those 30 odd million people, and or some of those 30 odd million people there. And it really is an issue. And another thing I would say that we've heard a lot of, and it's probably not a new challenge, but it's something that we're hearing even more from the field now is just a lack of also lack of training for managers who are managing staff, and that becomes a problem in terms of retention for the people that they manage. Just because managing people is not something that you're just born with and you just know how to do it, or at least most people really don't have that inherent skill. Something totally different there, but really just thinking about the lack of preparation that health centers, and it's not that their health centers are doing anything wrong. It's just really something that has come up a lot recently in terms of retention issues. So
Yeah, I'm going to toss one. Well, I'm going to do two things. Um, to the manager training, ACU is actually offering leadership training for managers right now. So we're, basically everything we do at ACU is member driven. And so part of what we heard from our folks is there is a need for that. There's a need for leadership development for that tier of managers, which helps with retention, which helps with all things. So if you are interested in more of that, that's something that's set to start here pretty soon. We've tried to make that very accessible and affordable to support folks because we know it's such a huge need. So just a flag on that. The other one that I would call out that I think comes up a lot, and it's something that sort of started through the pandemic, but I think it continues to take shape, is what do hours look like, and virtual versus in person, and preferences in terms of like the realities, the operational realities of how care is being provided. I think that increasingly and in different segments of healthcare workforce, what I am hearing for a lot of behavioral health and mental health, depending on the area, is like they don't want to be in person. They want to do everything virtual. Some health centers and some patient populations that works, others it doesn't. And again, I think across the provider space, I hear some version of that where, well, I only want to do one day in person and I would like to do the rest virtual, or some variation to that. And so I think the challenge being, how do you make that puzzle fit together? It's sort of like, can you construct a team where you can have a balance of in-person and virtual offerings that meet the needs of your community and the needs of your team? And so I give so much credit to all of you for the work that you're doing, because I think that's another complex challenge with a solution to it, but not easily constructed. And I think because there is a shortage of healthcare workforce, there's this pressure to meet that demand, and sort of to meet that requirement. So, man, there's a lot out there. But sorry, Rick, back to you.
Oh, no, thank you. No, that there is, and honestly, a lot of that balancing act, I think, really fits into our third question as we approach the end of our panel, which is what are the possible solutions or insights that you would share for health centers who really are facing these recruitment and retention issues? And perhaps we can start with you, Amanda, and then to Suzanne.
I was actually going to switch it up. I was going to say, let's
Oh,
have Suzanne start with this one, and then I'll follow it up because I know this is her wheelhouse. This is her expertise. So, Suzanne, you want to kick us off?
yeah, absolutely. Thank you, Rick and Amanda. So I think first thing and foremost, have a plan. Recruitment and retention and workforce in general is incredibly so whether plan um, you don't really have one and you need to write one down from the beginning, do that. And if you haven't revised your plan recently, do that too. This is something that can feel a little bit cumbersome at the beginning, but getting everyone on the same page and understanding where you are and where you want to go is really critical when it comes to workforce, whether it's recruitment, retention, or workforce development in general. Just, developing the workforce, that's really crucial. Second thing is I would say is invest in professional development, whether or not you have a scholar or a loan repayer through the NHSC or other loan repayment programs, or you just have staff that is there from the community. Invest in your staff. And as Amanda said, one of the things that we are developing under the National Center for Workforce Development and Training is a manager training series, and that kicks off next week. It's very accessible. It's led by our director of the National Center Center, April Lewis. She is a dynamo. She's fantastic. And it's just, again, we've really tried to make that accessible for folks. So we'll put the link in the chat towards the end there. So invest in professional development. And then third, reach out for help if you need it. There are so many entities, including ours at ACU and Inline Group that you're going to hear from. We are here to help. We are a team and no one is an island. And, we really don't want you to feel that you're alone in your challenges or solutions, that you need to come up with all the solutions yourself. We really want you to feel like you have, a home here at ACU with our partners and things like that. And we really want you to feel like that the solutions are, multifaceted and can really come from a lot of different places, and you don't have to have all the answers. So, in a nutshell, that's what I would say are some, pretty broad solutions. But anything else, Amanda, if you want to add before we wrap it up?
I think I would just echo, and I think that ACU has a number of amazing resources that between the Star Center and the National Center, as Suzanne mentioned, we're constantly developing programs and resources to be responsive to the needs that we're hearing sort of regularly and sometimes even one-offs. Don't be shy to let us know if there are other things. But I think the other thing is, and the part of the reason for the conversation today is that we're very fortunate to have really great partners in the space. And I think Inline very much exemplifies that, where ACU's kind of support and services and programs end, though we're always building them out, we can't do everything. And that's where Inline can come in and be really supportive. And so the other thing that I've really appreciated about the Inline team and the approach that they take is that they're genuine partners. They are great listeners, and where they're not in a space already, they're constantly doing the same thing that ACU is, where they're sort of trying to be responsive to those needs. And so it's probably a great segue, Rick, to jump into the next portion of the discussion. Does that work?
Indeed. Thank you both.
Okay. Well, then I am really excited to be able to introduce our next two speakers, and I'm pulling up their bios because I want to make sure I give them all of their accolades. But I've been really fortunate to work with both of these folks, Joe for quite a while and Caitlin at least the last year or so, and just really appreciate both of them. Joe Valdez is Inline Group's Senior Vice President, I think, of sales, but Senior Vice President. His history in the space of workforce recruitment is long, and his work with health centers is quite deep and rich as well. Joe is somebody who has firsthand seen personally and worked with health centers to try to overcome some of the challenges that we just discussed. I've witnessed his personal investment in the mission of health centers, and that comes through in the work that he's doing, in the conversations that he has, and in his connection to the folks that he's fortunate to work with, but also just really anybody in the space. I think that's the other thing. Obviously Inline is a business, but they're partners and they're friends, if you will. And so whether it's being able to connect you guys with their supports and services or connect you with others working in the same space, not necessarily workforce, but sort of, oh gosh, have you talked to this particular company about this other need that you might have? They're serving as connectors as well. And Joe is just ultimate at that. His colleague, Caitlin, is Inline Group's Vice President for brand and growth strategies. Caitlin is a rock star. So basically from my first call with Caitlin, I was like, oh my goodness, I really like this woman. She's so smart. She totally gets it. And she does phenomenal work in terms of, again, sort of that active listening, thinking about, okay, what are the solutions that Inline can continue to build out and bring to health centers? And so Caitlin and Joe just make a phenomenal team. So I'm really excited for them to jump in on this conversation. And I think we're going to start with you, Caitlin. Is that right?
Yeah. Yep. Thank you so much, Amanda. We love working with you guys, and we're very excited to give you guys some hopefully really tangible things that you can take away from this conversation about how you can support your recruitment. And then, of course, Inline is always there as well to be more of a support if you have other questions and things after this call. So we can go to the next slide. So it's really important when you're thinking about recruitment that you're thinking about who you're targeting. So don't just think about recruitment as a job description. Think, right? You're going to think about recruitment as a person. And what we know from marketing and interacting with candidates and our recruiters and everything that they're doing, boots on the ground, is that 66% of healthcare candidates are often passively looking for jobs. So they're not just sitting there going, oh, I need a job today, right? They're just browsing and they see something that attracts their eye and they're willing to speak. And that's one of the reasons our platform has a year-long subscription service, because again, what we're saying is, it's very helpful to have evergreen kind of constant posting about needs at your facility, because you never know when you might catch the right person's eye and that is your dream candidate. And so you want to be able to attract them, right? So it's really important to make sure you do, on your own website, have evergreen kind of career content, so that you're kind of actively marketing yourself. And we can go to the next slide. Another great thing when you're thinking about who you're targeting, right, is, and again, we work primarily with physicians, but this can, the same kind of logic can be applied to any type of recruitment need that you have. You really want to try to figure out what is the need of that person, right? What are they looking for in a career? And so the Physicians Thrive is another organization that helps physicians with their contracts and negotiating and those kinds of things. And they did a study of all of their physicians that they work with, and they kind of pulled together this: what part of the job do you find most rewarding? And I think this is really important when you're thinking about how you're attracting, right? What you're going to be saying about your center and what that provider would be joining. It's really important to kind of have these insights. Being very good at what I do, gratitude and relationship with patients, right? You're going to want to play up those things in your outreach and in your outsourcing kind of recruitment work. So we can go to the next slide. It's also important to understand maybe why someone might be looking for a new role, and how could you, in your job description, in your marketing efforts, in your outreach, your phone calls, right? How could you talk about how your center might help alleviate some of these concerns, right? You're never going to know someone's exact concerns until you're on the phone and actually talking with them. But you can think about things, maybe like Amanda had said, trying to find ways to have more creative hours, right? How can you, stand, and then list that as a key point about your job. Don't bury it in the bottom, right? Every job description is going to have degree, years of experience, right? Like, people want to know what about this job is different. And so you want to, anytime you can combat one of these things with a benefit or something from your health center, you want to make sure you wave that flag, right? You want to make sure you get that out there. We can go to the next slide. Another thing from this study that I think you're going to continue to see a trend moving towards this in the future is that a number of physicians are really saying they are willing to accept different comp packages based on that new employer being able to help them achieve a better work-life balance. And so it's really important to, again, bring any unique or creative way that you can help do that, and think about ways that you can organize your benefits around that. There are doctors who, if they're maybe just experiencing one of those days where they're just like, I just can't do this anymore, right? If your job comes up, right? If they're just kind of out there browsing and they see that you have a commitment to helping them achieve their work-life balance, right? That you see them as that potential candidate, it's going to increase your odds of them at least clicking, coming into your network, reaching out, following you on social, right? And a lot of marketing is, how do you cast a net and bring them in so that you can continue to talk about your message, and continue to convince that provider, that maybe this is their next home. So you can go to the next slide. So really, there are just a couple strategies when we want to talk about, how do you talk about who you are, and why that candidate would be a great fit. And so if you could go to the next slide. I'm sure many of you have heard of the public narrative. It's a community organizing strategy, and I think it worked really well with, this group being community health centers, right? And so it's the idea of the storytelling model of, you're trying to engage like the heart, the head, and the hands, right? You're going to motivate, provide a strategy, and then lead that person to the action that will help you guys achieve a shared goal. And I know that can sound a little far out and complex when it just comes to recruitment, but you're a health center and all of the challenges that Amanda and Suzanne talked about, right? It's really important that you have a unique way to catch that potential candidate's eye, and to, again, bring them in, right? You're going to plant little nuggets and you're trying to bring them in. And I think if you can think about talking about your center in this strategy of, the heart, the head, and the hands, it's a really useful strategy for recruitment. Again, across any type of recruitment that you're doing. So the next slide. So I probably should have said next slide a little bit ago, but this just kind of lays it out for you, right? When I say the head, the hand, the heart, right? So you start with the story of self, then you tell the story of us, and then you tell the story of now. And I want to make sure I'm being clear. When I say story, these are quick points. You could do this in 3 sentences, and then you can expand on it later on. You can do just talking about us and the now, right? Like you can use these methods in a couple different ways. This isn't writing a novel about who you guys are. This is, again, just thinking of this framing of how do you talk about yourself. And the next slide. So the story of self, which is your healthcare center, right? It's the why. So why are you there? And why are you trying to motivate someone to join you? Right. And I know it's sometimes hard day in, day out when you're like, I just need a provider because we need to care for, right? But again, you're trying to attract candidates, you're trying to bring people in. And so motivation and the why is going to be really important there. So you're going to frame something from maybe the viewpoint of the center as a living, breathing thing, right? That's the story of self. And then you can go to the next slide. So the story of us is really where you're taking health center, right? And you're now saying potential candidate, recruitment, people out there, come join us, right? So now you're going to be telling a little bit about what is this shared values. As a health center, we value community. As a health center, we value family. As a health center, we value serving this type of population. And now you're going to talk a little bit about how finding connecting values between that and the candidate, right? And again, this sounds a little deep, but you have a very limited amount of time to catch someone's eye. And so you need to pull at those heartstrings, but not just in a, heartstring kind of sadness, right? It's motivation, it's values. What do you value, and what will you two working together, right, kind of express those values? Or how can you express those values from your center in real stories, not just, the standard, you go to someone's website and it's like, we value this, right? We value family. Well, explain how you value family, right? Really create that emotional connection. And the next, so the story of now is your call to action, right? It's your challenge. So you've talked about who you are as a health center. You've talked about shared values that you and this potential candidate, that you and this potential employee share. And now you're saying, come with me, right? We share these values. There's this mission that needs to be achieved. We share the same values. You can join us and impact that mission. You can be the change in the world, right? Like you can do this with us. And here's the future that we'll create when we do it together. And again, you don't need to be overly like a world with cancer free, right? Like that's not, you're talking about the little things that you guys will be able to do together to impact and make a difference today, right? It's the story of like now. So together we're going to do this and we're going to have this impact. So, yeah, thank you. So kind of putting it all together, this is a very rough or loose kind of like way of demonstrating it, right? But as this, in a sample one is like at a community health center, we serve patients like Sam Davis. Sam is a father of 3 who's pre-diabetic. Our clinic has helped him access providers that have helped him through medication and lifestyle changes to prevent diabetes for 3 years. Sam takes what he learns at the clinic and he makes sure that his daughters develop a healthy lifestyle choice as well. So you're sharing that value of community, right? So it's not just about the one patient you serve, it's because you're here to improve the health of the community that you live in. And then again, I'll keep reading. We know that community health centers impact spreads far beyond our patients and into the communities we serve. We'd love to talk with you about our openings and how you can help us create more stories like Sam. Right? It's very quick. And again, instead of just saying our patient population maybe struggles with prediabetes, right? You're giving them Sam, and Sam is a father, and Sam has his daughters that he's taking, right? And you're making that kind of boring, let's read the bullets about this job, and you're putting it into a story. It's very concise. And now that provider could be like, okay, this is the type of impact that I would have if I joined this health center. A lot of times we would think, don't they know that, right? Like if you're working at a community health center and if my job is posted on something called, the Association for the Clinicians of the Underserved, wouldn't they know they're doing that? And you're right, they do. But storytelling is really the way into people's hearts and into people's minds. And then it's the way to get them to join a collective action. And so it's always the best to think about your job description and your recruitment tactics as you're telling the story of what this person's career will be like with your health center. So you can go to the next slide. So this is, just a little nitty-gritty marketing tips from the Inline Group, because that's what we do, right? We help health centers get in front of candidates and make sure that candidates know about their jobs, and our recruiters are able to talk about all of our clients, and then they're able to help answer questions for providers and really help connect them with you, right? They're able to talk about your center. And so just a couple quick marketing tips, right? When you're doing your outreach, you want to use kind of like a carrot and stick approach, right? You want to make sure the initial outreach and what the mass message you're getting out there, right? If you're going to post on social, if you're going to send an email, even in a recruiting phone call, right? If you're just leaving a voicemail, remember that the world now lives in 30-second, sometimes 15-second news bites and Instagram reels and TikTok. And you got to get to the point. And so we use this strategy of, what are the 3 big things that you should know about this job? Compensation is definitely always one in there, but don't in your top 3 points, don't just list like competitive benefits, health insurance, right? They're going to be like, yeah, that kind of, right? What's the differing benefit? American Cancer Society for years always gave their employees off on their birthday because that was their campaign. They celebrate birthdays, right? They celebrate creating more birthdays. And so one of their benefits was every employee gets their birthday off as a free PTO day. It exemplifies who they are and what they do and what they stand for, and it's a reward, right? And so that was always like at the top of their recruitment list. It's one day off, but it's telling what you're going to join and what organization you're going to come work for, right? So you want to make sure your top 3 selling points are what providers want to hear. So again, thinking back to those previous slides of what do providers like, right? About, and then where do they struggle? How can your top 3 points hit on those things? So right, you could talk about compensation, but you could also in that bullet point talk about compensate, or you could talk about days off, PTO policy, all of those things in relationship to a work-life balance. So again, be thinking about who your audience is, and don't just list the point that you see everywhere. List the points that make you stand out, because this is your 30-second, I'm scrolling. Oh, that actually sounds interesting, right? So you start with those top 3, and then you have your very quick elevator pitch, right? Of my story, right? This is our story. This is who we are. It's 3 to 4 sentences. That's probably 4 is a lot, right? 3. Because most people are reading things on their phone, especially in an initial outreach, right? They're going to see it on their phone. If they really want to read more, then they might open it up on a desktop. So again, you want to be thinking about a screen this big. And so your first outreach, you want it to be quick and to highlight those things that make you stand out. Then you're going to want to drive them somewhere where hopefully you have analytics and tracking and things. You want to drive them to another place where they see all the details. You don't have to say everything up front. You give them a nugget, you get them to join you, right? Come over. And that's what the Inline Group does with our client landing pages and stuff, right? So that's part of our services. We send out this marketing material to candidates. We use these strategies that I was just explaining. And then again, you bring them in and you capture them, and then you continue to communicate and keep going. So you want to make sure that you have something where you're sending them, where you can capture them and capture their information, capture their email address, capture their phone number, right? So that you can get that opportunity to do a longer pitch. And the next slide. Again, just some helpful hints and tricks and tips for you guys, because I know recruitment is just, a bear. Just remember 66% of providers are looking for stuff online. So make sure everything that you have is mobile ready. Think about it from when you're writing your content, but also make sure your health center website is mobile friendly. And so that, again, anything that you publish on there could easily be viewed on a phone, social, and all those things. Text alerts have gotten really popular. That's a very big thing for providers. So often having something in your outreach where you could maybe get them to give a phone number, get them to give, to consent to texting in that I've captured you, right? Text alerts are a very good way to start that call. Hey, I noticed this, call me when you have time. We can set up a time. We can schedule around your schedule, those kinds of things. And then, of course, so make sure, you're using your community's social platforms where people in the community go to talk about your job, and that you have positive social media messaging. And I believe the next slide. So this is Care for the Homeless. They are one of our clients, and they have been a client with us for many years, but they obviously have multiple locations. And so, again, being a health center, they need something that fits within their budget for kind of constant recruitment, but it may not always be at the same place, right? So it's like the needs are going to change and adapt around the city, but we need help making sure that our message is marketed out there so that people know we're here. So the next slide. So then they've been working with Inline, and again, our solution is this brand awareness. So when you work with Inline, we have an account manager, again, who's going to talk to you and get to know you and get your job description, but learn more about your center so that our recruiters can help continue your story, right? So that when we're talking with a provider, we're not just reading a bunch of, oh, it's this much salary, it's this many patients, right? We're saying this is the type of work you'll get to do. And then, of course, we are able to support Care for the Homeless by doing all of their initial outreach and early screening. So we're kind of helping them filter through, the weeds, right? Seeing everything. And then we're sending them screened candidates with a quick summary of, hey, why is this candidate interested in your role? Here are the quick things you need to know about them, and before you consider them. And again, our consultation and support, again, working with that account manager, Joe can talk a little bit about that as well, but we try to be your partner. And so we really want to talk to you about what your needs are and where we're seeing strategies that could help in a couple of different ways. And so Care for the Homeless was able to, with posting their positions and stuff, fill 6 vital physician openings within about 18 months at their multiple facilities. I was just looking, they've had 17 hires total, but we wanted to make sure we kind of snapshotted it within the last 18 months. So that is Care for the Homeless. And so we can go to the next slide. So yeah, I'm going to turn it over to Joe because I am kind of the strategy person, but Joe is the true partner in all of this. So I'll turn it over to you, Joe.
Thank you, Caitlin, and thank you, Amanda, for such a gracious introduction. And, to go back to one of the challenges that we see and why I'm so passionate about what we do here at Inline Group is a challenge that I have seen in recruiting since I've been doing it now for 24 years is candidates that are not familiar with the movement, or maybe they think they are, and there's this perception that health center jobs, they're going to be overworked, underpaid, poor working conditions, not going to have work-life balance, and not going to find high job satisfaction. And we know that totally is not the case for our health centers. So being able to overcome that first challenge, we talked about some recruitment challenges in rural areas really and across the country with housing, and the list goes on. The very first one that we encounter is, can we even get to tell our story to the health center? So that's what we focus on, just getting that very first challenge overcome, engaging the workforce. But thank you, Caitlin. That was a wonderful presentation, and hopefully everybody thought it was informative.
Yeah, thanks, Joe. I just, help do the strategies of you guys bringing me the people and the needs. So that's what I love about Inline. All right, I think that is our part of the presentation. So we'll turn it back over to Amanda.
Thanks, guys. Well, I think at this point, we're going to open it up for some Q&A. So if you have questions, please put them in the chat. I know that one question came in a little earlier about the conversation around National Health Service Corps and HRSA and funding. So I want to take a minute to just sort of explain what's happening there. So basically, during the pandemic, there was a billion-dollar investment made in the National Health Service Corps, which is unprecedented. It was incredible. But at the time, obviously, we really needed it, health centers in particular, as the majority user of organizations that leverage the National Health Service Corps, although there are others who do as well. What the Bureau of Health Workforce did was they took that billion-dollar investment and then they figured out it's called Know Your Money. So basically they could spread that out however they wanted to. So they, of course, did a massive infusion right off the bat. And that took the field strength for National Health Service Corps up to 20,000. So they had 20,000 National Health Service Corps providers in the field all over the country, largely with health centers, but also with some other grantees. The other thing is because there were so many dollars available to support placement for loan repayment and scholarship, the HPSA scoring, which some of you may be familiar with, but basically your health professional shortage area score as a health center or as a provider organization factors into how they approve applications for either loan repayment or scholarship. So when you have more dollars, they can fund more and more and more applications. So at the time when they started this, they were able to fund applications that were coming in with very, very low HPSA scores. So almost down to 1, literally. And as you all know, health centers have to be in an MUA, which is a medically underserved area, all these lovely acronyms. So there were qualifiers right off the bat that basically cleared the path to making sure that they could get as many loan repayment and scholarship applications filled during that time. However, you have this pot of money and year after year, there's less and less to distribute. And then you also have to remember when you approve those applications, you're approving for 2 years. So what you have in year 1 impacts year 2 and 3 and 4 and so on. And so basically that pot of money is shrinking. So that's going on and we're sort of at the tail end of that. And so the resources available to put toward loan repayment and scholarships just in general is far smaller than it was just a couple of years ago. And so the field strength is shrinking. Basically, every year it has the trend so far. It's come down about 2,000 providers. So the peak, it was at 20,000. The year after, it was around 18. I'm guessing we're going to be somewhere. I haven't seen the data from the previous UDS because we're always a year behind with data. I haven't seen the recent numbers, but I'm guessing that it's probably 16, 17,000. And I think if we don't see increased funding, we're going to see the field strength come down to pre-pandemic numbers, which was somewhere between 13 and 14,000. So that's the track with that. Now, layer into this, HRSA also recalibrated what they're offering in terms of the total loan repayment and scholarship amount. The reason that they did that is it hadn't been adjusted in years. And so the reality is the cost of loan repayment is more, where it was 50,000 over 2 years, that number needs to come up. Same thing with scholarships. The cost of going to med school has gone up since the last time they recalibrated this. So that also factors in terms of okay, so then when the remaining dollars you had in that pot, you're actually going to have fewer folks that you're going to be able to cover for scholarship and loan repayment because you've recalibrated those numbers. But that was desperately needed, honestly. And then the final piece is that BHW, HRSA included a small incentive for Spanish language speakers to leverage $5,000 additional dollars as a part of loan repayment and or scholarship, or actually, I think it was just on the loan repayment side. So you have all these factors. The final piece is the HPSA scoring process, which is a process that happens repetitively. There's an auto HPSA, there, you go through the process, you get your HPSA score. That factors into then how they award those scholarships and those loan repayments. And so, frankly, all of these things are working in the wrong direction. It is not the fault of BHW. They are doing everything they can to stretch those dollars to make the loan repayment and the scholarships more competitive to give you guys a better recruitment and retention edge. But the reality is, and this is why advocacy is so important, the dollars and the resources are shrinking. And so ACU is right now circulating a stakeholder letter in support of increased funding for the National Health Service Corps and the Teaching Health Center program. It aligns with what was included in the Sanders-Marshall bill. So for National Health Service Corps, it's $950 million. That would keep us, if we could get funding up to $950 million, that would bring us back to at least maintaining a field strength of 20,000. So that's what we're trying to do. There's need well beyond that, quite frankly. But I would encourage you guys, if you have more questions about this, if you want to get even more into the weeds, I'm happy to do that. But I would also encourage you to consider signing on to the stakeholder letter if you haven't done that. It's available to health centers and partner organizations. It's not for individuals, but it is for any organization that's connected to the National Health Service Corps or the Teaching Health Center program that would like to see increased funding. So maybe we can put a link for folks to be able to do that in the chat just so it's easily accessible. But there's a lot of work to do. And the one thing that I would say is that from an advocacy perspective, I'm taking liberty. I know this is a workforce conversation, but I'm going to put my advocacy hat on for a second. Right now, and between now and the end of the year, Congress has to make decisions about what they're going to do with funding for the health center program, for National Health Service Corps, for teaching health centers. So we have a very important opportunity to be in communication with our congressional members, House and Senate, to implore them to take action, not just to make sure that the funding is continued, but to see an increase, and not just for the health center program, but also for these very important workforce programs. The National Health Service Corps is not the only workforce program out there that's vitally important and critical to the recruitment retention efforts that we've been talking about. But it is one that's very effective. It is also one of the biggest drivers of workforce diversity in the clinical space. And so we very much believe and advocate heavily for that program, of course, at ACU, but also want to hear from you guys. You know, I think there's a ton of work to do, of course, and we want to be as supportive as we can. So, okay, I think hopefully I covered that question and clarified. A bit of a diatribe for me, but other questions from you guys for our speakers, for Suzanne or myself, or you can just share sort of strategies that you're either deploying and having good luck with, or things that you've tried and haven't gone so well. Again, would love to hear from you guys and kind of leave it open. Any questions? Okay, another question that just came in about HRSA raising the amount this year, but fewer received it. So basically, it isn't, so fewer received it because they did increase the amount, and they increased the amount because the loan repayment number and the scholarship number, like the actual dollars that they apply for that, hadn't been recalibrated in years. And so basically the wisdom was, okay, we've got to catch up with the times, even if you just look at inflation. Not that $50,000 over 2 years is a sneeze, but is that competitive when you're looking at what other healthcare organizations, the Kaisers, the hospitals, the private practice groups, what they're offering, frankly, in loan repayment? Was that number, was that 50,000 over 2 years, was that compelling, or did it need to be recalibrated? And same thing with scholarship. The cost of going to med school, first of all, varies wildly depending on where you're going to school, but the cost of going to med school has gone up enormously since the last time they calibrated these numbers, which I think was, I want to say it might have been around the same time last time we did base grant adjustments, which would put it in 2016. So there are fewer awards because they did recalibrate, but also the bottom line is they just have fewer dollars to work with. And that's because Congress has failed to increase the amount. So I think the intention and the wisdom was, okay, we need to increase the amount that's going out to the field in terms of a per person allocation. But we also need more resources to be able to continue to do that and expand. So hopefully that helps answer. But if you have more questions on the HRSA front or on National Health Service Corps and sort of the funding elements, I will put or actually, Rick, can you put my email address in the chat and feel free to email me. I'm happy to talk with you guys about this. I love wearing my advocacy hat always. But other questions, comments, feedback in the last few minutes here. All right, guys. Well, I can imagine I was feeling a little quiet earlier today too, so I will not push too much harder. It's always nice to have a few minutes back, especially so that we can, grab a drink of water or use the restroom or catch our breath between now and the next meeting. But I just want to say thank you so much to Caitlin and Joe. We value the partnership with Inline so much, and I have heard firsthand from our fantastic members and other health centers within our network that are working with you guys, the value that you've brought to them and the success that you've had in working with folks. So thank you and keep it up. We'll continue to make the connections as we can. Thanks to everybody for joining us today. I know it is an enormously busy week and an intense one at that. So I appreciate you guys taking the time to join us for this conversation. And if you're feeling shy or quiet, but you do have comments, feedback, or anything that you want to follow up with, please be in touch. We love hearing from you. We want to be a support, of course, and always a resource. So please don't be shy. And then just another big thank you to Suzanne. She is such an incredible leader for ACU over the National Center for Training and Workforce Development at ACU, and just paving the way in terms of incredible programming starting next week, but also well into 2025. So thanks, Suzanne, Rick, and Jen, everyone for joining us today, and hope the rest of the day can be a great one. And we'll look forward to seeing you guys on our next conversation. Have a great day.